event is a collaboration of the Ministry of Health, the Aga Khan Foundation, the Aga Khan University, Johnson & Johnson Foundation, as well as the Nurse and Midwife Alliance. Let us take a short step back. Chronologically, it may be not too short, 2 years ago, when COVID fell upon us all. And we all shuttered ourselves in different locations, in different homes, confined to four walls of different dimensions, yes, but nonetheless confined to four walls. However, ladies and gentlemen, we had the frontline workers who did not know what was going on.
Silently, we continue with our work. We are aiding inside, and we cannot perform. But nobody cares. How is this nurse? How is this health worker dealing with this?
I'm a trained accountant, but doing community health work. And we started the programs in the villages where once you mention COVID, people would run away from you.
Ladies and gentlemen, it is an exciting moment for us to be gathering here today to witness some of the work done under the Partnership for Protecting the Well-Being and Strengthening Resilience of Frontline Health Workers in Resource-Limited Settings in East Africa, which indeed is a partnership between the Government of Kenya, the Johnson & Johnson Foundation, and the Aga Khan Development Network. The partnership between the Government of Kenya and the Aga Khan Development Network is expansive and benefits from many decades of mutual and positive and forward-looking cooperation in diverse areas, including health, education, early childhood development, economic development, and civil society development. Equally, our relationships and level of cooperation with county-level governments ensures that solutions are grounded in evidence and responsive to emerging needs. We believe and have indeed experienced that this approach to partnerships yields powerful, impactful, and sustainable outcomes.
And there wasn't much info on how could we leverage on technology to ensure that we scale up mental health services for our frontline workers. So in conclusion, this very extensive study done over around 15 months, looking at burden and looking at ways to address it, indicated that there is a high prevalence of mental health disorders among both nurses and community health workers. And we know that the key to ensuring quality healthcare services and achievement of quality universal health coverage is really to take care of the well-being of the health workers.
And so these are some of the issues that our frontline workers, go through. A lot of it, and they may not really have, that sort of support that that they need. What is there? What's going on? What are people saying? What is working? What are the challenges? Where can we put effort so that we are in a better position to support the frontline health workers who are very critical, especially in this period?
Evidence generation and knowledge translation is an interesting area to think about when you're in the developing world, because there's very little coming out. There's even a lot less that is translated into practice and policy. Today marks a great milestone for this activity that we've engaged in as AKU, as we push the evidence that we've generated into the next critical steps of implementation and translation.
The Center for Health Worker Innovation is our commitment as Johnson & Johnson to impacting the huge gap in availability and quality of health workers globally, with an objective of deploying $250 million by 2030 in order to reach 1 million health workers that will in turn impact 100 million people globally.
Many a times people look at how we can be able to cut costs to be able to offer other services. Yet, if you don't invest in health workforce, whatever cost containment measures you put in place will be a nullity. They will not yield any desired goals, because the crux of any healthcare system is the health workforce.
Now, close to 1/2 of Kenyans will experience or have already experienced at least one mental health condition in their lifetime. Mental health conditions are a growing public concern and in all parts of the world. In addition, we need to address the mounting pressures on the frontline workers. A big thank you to the frontline workers and champions for sharing the data and perspectives with us. Also, thanks to many organizers that made this event a success. So a round of applause for the organizers.
And today, the one thing I can say I have learned is that when a nurse comes up to me and I'm not feeling bad, my back is hurting, or I have something ailing, or I've brought a relative, I need to smile at them, or at least say hello in a kind way.